In chronic kidney disease, the host bone loses its structural integrity. When we introduce a rigid implant, we create a stiffness cliff, an extreme discontinuity that disrupts the body's natural mechanics. Welcome to a presentation of the latest research published in Recent Advances in Clinical Trials by Dr. Qiming Qiang and colleagues at Chung-Yuan Christian University. From a wave mechanics perspective, this abrupt impedance mismatch promotes energy reflection at the interface, transforming load transmission into destructive mechanical noise. We hypothesize that this noise perturbs the shoulder's neuromechanical coordination, disrupting the physiological 2-to-1 scapulohumeral rhythm and driving compensatory dyskinesia. To address this, we implemented a biological impedance matching strategy specifically designed for metabolic shoulder arthroplasty. Instead of a rigid prosthetic glenoid, the resected humeral head is contoured into a structural autograft for glenoid resurfacing. Because the autograft shares the same metabolic history and viscoelastic signature as the host skeleton, it creates a compliant, low-reflection interface. This reconstruction attenuates mechanically generated error signals at the bone, construct boundary, allowing for smoother mechanical transmission. Post-operative assessments demonstrated the recovery of smooth, coupled scapulohumeral motion, effectively dechaoticizing the preoperative kinematic pattern. Radiographic follow-up supported successful graft integration, maintaining joint congruity and confirming the stability of the reconstruction. Clinically, this construct avoided the rocking horse instability and pain amplification often observed when rigid interfaces oscillate against softened bone. Restoring shoulder rhythm in metabolically compromised hosts should not be seen as just an anatomic problem. It is a signal-to-noise problem at the interface. By taming the stiffness cliff through biological impedance matching, the reconstruction becomes mechanically quiet. This allows the sensorimotor system to disengage from protective guarding and re-enter a stable physiological kinematic attractor. For the full manuscript, please visit our website.